Welcome back. We are answering your coronavirus questions with Dr. Cynthia Snyder from Cone Health. All right, this person says, my boyfriend and I are recovering from COVID. Do we have a greater chance of getting COVID again immediately?
So when folks have had COVID and probably have been symptomatic from it, you usually have and recovered and have antibodies. So you are protected from getting reinfected. We just don't know how long that protection lasts. We suspect it's anywhere from 3 to 6 months.
3 to 6 months. Okay, this person says, is it possible for the virus to transfer via secondhand smoke through common vents in an apartment building?
So that, I think, gets to the point of, is this like an aerosolizing type of infection? It really depends on how many people are sick and how close they are to one another for like secondhand smoke. But in terms of going from one apartment to the next to the vents is unlikely. And we haven't seen that yet in other places.
This person's asking, is it okay to visit during the holidays if some people have their masks on and some without? Am I protected if I have my mask on and other people don't have it on?
So that's still kind of risky because it's good that you yourself are wearing a mask, but ideally everybody should be wearing a mask and it should be a well-ventilated area and people are staying at least 6 feet apart.
This person's asking, will receiving the COVID-19 vaccine be risky for people with heart trouble?
So when somebody does have heart trouble, you are at risk of having complications of COVID. So we really would like, people who have risk factors should get vaccinated. It is not thought to, the vaccine is not thought to worsen any heart troubles that we know of.
How long does the vaccine last?
That's a great question. We don't know quite yet. We don't know if this is a one shot that's one and done that lasts like every 5 years, or is this something more similar to the flu vaccine that needs to be just, tweaked a little bit every year to cover the circulating strains.
This person's asking, should you take ibuprofen before getting the vaccine? And I'm guessing that's to like ward off any pain that you would feel in your arm.
Yeah, from what I hear and experienced, a lot of people don't necessarily feel the injection when they get it. It's usually like 6 to 8 hours later. So taking ibuprofen at the time of the vaccine is probably not needed.
Okay. This person's asking, so many people are misinformed. They think if you're allergic to penicillin, you can't take the COVID shot. Can you clear this up?
Sure. So our concern is that if you have anaphylaxis to any components of the vaccine, that's definitely the highest risk. Folks who have allergies to penicillin, it depends on the allergy, but for the most part, it should be okay. If it's anaphylaxis, again, it's just like you be watched for a longer period of time to see that you tolerated it, and some folks have already done fine.
This person says, would it be safe for those who have not tested positive to be around individuals who were positive over a month ago and have recovered?
That's a kind of a tricky question because yes, that it depends who else is on that component. So correct, you're in the presence of somebody that's immune, so you're unlikely to contract it as long as they've recovered. As long as it's been the person who's had it is recovered and doesn't have any residual issues with it. We still advocate for everybody to wear a mask if you're not in the same household, though. It's still winter, it's still respiratory season. There are other respiratory illnesses right now that mimic COVID that are out there.
This person says, do you need a follow-up visit with your doctor after having COVID-19, or do you need to get another test to see if you're negative after quarantining?
So when somebody has COVID, depending on how sick they were, if they required to be hospitalized, their isolation period is about 21 days if they've had some serious complications from it. If you didn't require to be hospitalized and had like moderate to mild illness, your isolation period from being sick is 10 days. And after that time frame, you can return to work, you can go to your doctor's visits, and they shouldn't require you to have a negative test to be back in those scenarios. Quarantine is a little bit different. That's after you've had an exposure. So let's say somebody I saw in the clinic and I forgot to wear my mask for some crazy reason and they coughed on me, right? And they ended up having COVID. So my quarantine period in an ideal way should be 14 days. And I don't need to get retested. And I could, unless symptoms started. But if I wanted to know sooner, I could get the test around day 7.
Really quickly, this person says, I tested positive in September. The only symptom I had was I could not smell, and I still can't smell. How long is that going to last?
You know, some people, their sense of smell returns quite quickly, and others can take longer. I've had some folks with other respiratory illnesses lost their taste and smell for about 9 months. So it's really kind of individual. And it's kind of sad, you know, but hopefully they'll come back pretty soon.
Wow. Okay. Thank you so much for, again, answering all of those text questions. Thank you for sending in those text questions. We learn something every single time we do this. And WFMY News 2 at 6 is next.